Hello, Marcus. I am responding to your post on the cage questionnaire. So, I work with forensic clients and I have to administer assessments to the clients who are incarcerated in order to pretrial commitment at the forensic hospital. And the three assessments that I administer are the brief psychiatric rating scale, the Georgia competency test, and the final one is the cage aid that is adapted to include drugs. We use the KJ to determine if substance use is an issue prior to the client being admitted to the hospital. And based on the score, this determines if their treatment plan will include substance abuse treatment. So, according to Vandernagel et al., substance use and offending behavior are correlated, and this is the primary reason that forensic hospitals use the cage and they take this into consideration when analyzing substance abuse or substance use prior to admission. I actually almost made the cage the topic of my discussion post, but I decided to go on another path and write about another assessment that I was familiar with as well, and that is the Alcohol Use Disorders Identification Test, or the audit. So, Reddy et al. Stated that the cage questionnaire can either be used in conjunction with the audit or independently to identify those with problem drinking. In comparing the audit with the cage questionnaire, Reddy et al. Determined that the cage was inferior to the audit in identifying alcohol abuse that is mild, but that it was on par in diagnosing alcohol dependence. I also found it interesting that the cage does not perform well among certain demographics, such as white women. In reading the Dalla and Kopic's article that you cited, it was actually kind of surprising to read that the cage questionnaire performed better with black females. I also found it interesting in the Dalla and Kopec's article the fact that women have a lower prevalence of alcohol misuse when compared with men, which may also be due to underreporting on the cage questionnaire. Many women may have issues with obtaining child care, which will prevent them from going into substance treatment, or they may be suffering from a co occurring mental disorder and they may not answer the questions on the cage correctly due to these barriers. In my opinion, I think that the cage is one of the easiest and quickest assessments to administer to identify substance use and possible treatment options. And although the cage does have its limitations in determining mild alcohol abuse, as previously mentioned, the cage can be understood by someone with minimal understanding, and I think it's very helpful in initial determinations of substance use disorders. Thank you for listening to my post. I enjoyed